All right, everyone. I believe we're just under 2 weeks to go. Keep up the good work. You can do this. All right, let's take a look at Module 5. Module 5, Week 5. And basically, what we're going to be focusing on are all of the different DSM-5 classifications of psychiatric disease states. Everything from schizophrenia to depressive disorders, bipolar and related disorders, anxiety, personality disorders, addictions, kind of the works. That's an awful lot to cover in the period of 1 week, so we're not going to be going into incredible depth by any stretch. The corresponding chapters to Module 5 include chapters 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, and 33. And for those of you who continue to find the guided lecture notes and PowerPoints helpful, they are included for all corresponding chapters in this module once again. But let's take a look at the Module 5 assignments. You may be happy to know that there are just 2 assignments for Chapter 5 this week, although the assignment, Module 5 Assignment 1 has 3 different parts, and then there's the quiz. So let's talk about this discussion board assignment. Okay, so this is going to ask you to be a little bit creative and to think back in your experiences with patients and clients who have recently or not so recently been entrusted to your care. So for your initial post, you will be asked to write a thorough case study focusing on a patient or client recently in your care. The following should be included. Select identifying information, nothing that is readily identifiable. We don't want to violate HIPAA in this assignment. So age, sex, and other important demographic information that would still not allow a client to be identified. The client's chief complaint or their reason for seeking care. The setting in which care was implemented. You do not need to give the name of your facility, and please don't. You can just simply say inpatient, outpatient, emergency department, primary care office, medical surgical unit, something like that. You need to identify the presenting signs and symptoms that the client reported, which correspond with DSM-5 criteria, which you can find in your book in those corresponding chapters. And then you're going to want to put any other relevant information important to consider related to care planning and discharge planning from your holistic biopsychosocial assessment findings. Okay. Part 2 of this assignment is your first reply. So students should choose one peer's initial case study post on which to reply. Please, only reply to an initial post that has not already been addressed by another peer. I want everyone to reply to a different peer. Replies will consist of a patient-centered care plan similar to the ones found in this module's chapters within your textbook in the sections identified in the nursing care plan tables. Examples can be found on pages such and such. Replies should include the following. Top 3 nursing diagnoses. For each nursing diagnosis, the following should be included using examples from your textbook as a guide. The defining characteristics and related factors, initial and discharge outcomes, interventions with rationale and ongoing assessment. If desired, you can use a Word document to formulate your care plan, but you certainly don't need to do that. And again, you're going to be replying to the discussion board. The third part of this assignment is actually a reply number 2. So students are now going to go back to your initial post. You're going to read the nursing care plan that your peer formulated and posted, and then you are going to offer a constructive critique of the care plan, including rationale for support and rationale for respectful being the key, disagreement. Last, revisit the original case study and provide a brief summary of discharge outcomes and any revisions that were required at the time of discharge. So if we click on this, we can also see the grading rubric that's here. And I would again encourage you to always use your grading rubrics to guide how you're going to complete your assignment. So you'll see that the initial post, the well-developed case study that includes all of the required information, is worth a total of 12.5 points. Your reply post number 1, which is where you're going to develop a nursing care plan for the top 3 nursing diagnoses, that's worth a whopping 25 points. So this is the majority of the assignment point value right here. And then your reply post number 2, where students go back to their initial post and critique, that's worth, again, another 12.5 points. Okay, so it's a 3-part assignment that's worth a total of 50 points. Let's jump back to Module 5. Scroll to the assignments. And then the only other assignment that's listed is the Module 5 quiz. Again, you can take as much time as you need. You will see all of the questions at once. You can use your textbook and any supplementary material, but you can only take it once. So please do not click on that Begin tab until you're ready to take it. Excuse me. Additionally, if you have any other general course questions this week, please go back to the discussion board and please post them here under the General Course Questions and Answers forum. Only one more week to go after this. Keep up the good work.